Hello and welcome back to Time with Lydia, the pharmacist. Today I'm so excited to come your way again with another interesting content. And today our chat is going to be on the Bartholin Cyst. We are going to be looking at some causes, the symptoms, and then treatment of the Bartholin Cyst. The Bartholin Cyst is a cyst or an abscess that develops at the opening of the vagina. There's a gland on each side of the opening of the vagina known as the Bartholin glands. These glands secrete a fluid that helps lubricate the vagina. Sometimes the opening of these glands can be obstructed, and when this happens, the Bartholin cyst or an abscess then develops. Obstruction of the Bartholin glands can result from a bacterial infection, from a sexually transmitted infection such as gonorrhea or chlamydia, or from an injury. And typically the Bartholin cyst or the abscess will develop on only one side of the vaginal opening. The Bartholin cyst or an abscess is very common. Women in their reproductive age are more prone to developing the Bartholin cyst. Now let's move on to the symptoms. When the Bartholin cyst is small and not infected, you may not even notice it. But when it gets infected by a bacteria, it can become larger and an abscess will then develop. It would look red and swollen under the skin, and some may become filled with pus or fluid. Sometimes it can become so big such that it would create discomfort when walking or sitting or when having sexual intercourse. The good news is you can treat a Bartholin cyst at home by doing the following. Now, the first and easiest way to treat or get rid of a Bartholin cyst is to use a warm, moist compress. All you need to make a warm, moist compress is a small, clean towel and warm water in a bowl. Soak the towel in the warm water and squeeze the water out. Make sure the water is not too hot to burn your hands. And then apply the squeezed warm towel to the affected area every 10 to 15 minutes. And do this several times in the day. This would help reduce pain and speed up drainage of the cyst. Number 2, keep the affected area clean and tidy. Wash the vaginal area with clean water and an unscented soap. And number 3, do not pop or squeeze the cyst. I'm aware of the temptation to pop or squeeze a boil, an abscess, or a cyst, but try as much as possible not to squeeze or pop the cyst, because when you do, the infection can spread. The area will become more inflamed and painful, and complications can develop. So refrain from popping or squeezing the cyst. Number 4, if the pain is unbearable and there is so much discomfort, then visit your community pharmacy for some paracetamol or ibuprofen. And before you take any of these tablets, make sure you speak to your community pharmacist for advice. Also read the patient information leaflet so you would know exactly what you are taking, how to take it, and if there is any interaction at all with any medication that you are taking. Now, if after 2 to 3 days of using these home remedies or self-care measures and you don't see any improvement, that is, the cyst becomes bigger, is painful, and is causing so much discomfort, as well as it's become infected, then it's advisable that you make an appointment with your doctor. Now, there are a few treatment options that your doctor can recommend after a consultation and diagnosis. Your doctor can prescribe antibiotics for you when they think that there is a bacterial infection. They can also treat any sexually transmitted infection if a test reveals that you have contracted a sexually transmitted infection. Another recommendation would be a surgical drainage, and this would be done when the cyst is large. Normally, a surgical drainage will be carried out in the hospital under general anesthesia. One other recommendation would be a cyst bath. A cyst bath involves soaking in a tub filled with a few inches of warm water. And you would have to do this several times in a day for 3 to 4 days. It may help a small cyst to drain on its own. Now, our take home for today. Be aware that a swelling in your vagina can occur as a result of different things. It can be a boil, it can be a sexually transmitted infection, or it can be a Bartholin cyst. Anytime you develop a swelling, an abscess, a cyst, or a boil in your vagina, that is very uncomfortable. That is not going away with home remedies, and that is getting larger with time. It is appropriate that you seek medical attention to get it checked out. I hope this video is beneficial. Please don't go away without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please remember to hit on the subscribe button and also on the notification bell so you don't miss any of our informative content. Leave a comment in the comment section. Thank you once again for your time today, and I hope to see you soon in my next one. Bye for now.